The Earth is warming. The signs are all around us, from the parched landscapes under a relentless sun to the shimmering heat waves on the horizon. Glaciers melt, seas rise, and weather patterns become more erratic and extreme. These changes are not just isolated events. They are interconnected symptoms of a planet in distress. But beneath these visible signs, a more insidious threat may be growing, a link between rising global temperatures and an increase in cancers affecting women. Scientists are beginning to uncover data that suggests this alarming connection. New research suggests a troubling correlation between increasing global temperatures and a rise in female cancers. This isn't just a hypothesis. It's a growing body of evidence that demands our attention. This connection demands our immediate attention and action. Activists and scientists alike are calling for urgent measures to address this emerging crisis. The subtle increase in average temperatures is not just an abstract concern. It has real, tangible effects on our daily lives and our health. It appears to be creating conditions that could foster serious diseases. The dry, cracked earth and sweltering urban environments are more than just uncomfortable. They're dangerous. The idea that our altered environment could be contributing to higher rates of female cancers is alarming. It's a wake-up call that we cannot afford to ignore. The health of the planet and the health of its people are inextricably linked. When one suffers, so does the other. Our well-being is tied to the well-being of the Earth. Global warming acts as a threat multiplier, potentially increasing our exposure to known cancer-causing agents. The rise in UV radiation and industrial pollutants are just a few examples. Understanding these pathways is crucial for developing effective strategies to protect vulnerable populations. Researchers and health professionals are working tirelessly to uncover these links. This essay will delve into this disturbing connection and explore the groundbreaking research that brought it to light. We will examine the evidence and discuss what can be done to mitigate these risks. A pivotal study, published in the renowned Journal of Environmental Health Perspectives, has cast a harsh new light on this issue. Researchers from the American University in Cairo analyzed data spanning over 2 decades across 17 Middle Eastern and North African countries. Their findings are stark and deeply concerning. For every single degree Celsius rise in average temperature, the incidence of key female cancers increased substantially. The numbers are alarming, signaling a public health challenge that can no longer be overlooked. With each 1 degree Celsius increase, cases of these cancers rose by a staggering amount. Deaths from these diseases also climbed significantly. Ovarian cancer showed the largest increase in both cases and deaths. These figures represent real lives impacted and healthcare systems strained. Dr. Wafa Abdelkader Mataria emphasized the gravity of these findings, noting the substantial public health impact. The data from these nations provides a critical early warning signal for the rest of the world. The implications are vast, urging immediate action from global health authorities and policymakers. This study underscores the urgent need for comprehensive strategies to mitigate climate change and its far-reaching health consequences. As temperatures continue to rise, the world must prepare for the cascading effects on public health, particularly for vulnerable populations. The research serves as a clarion call, highlighting the interconnectedness of our environment and health, and the pressing need for sustainable solutions. Rising temperatures might be linked to increased cancer rates through the enhanced release and spread of environmental carcinogens. As the mercury climbs, the behavior of these harmful substances changes, making them more volatile and easier to inhale or ingest. This means that even a slight increase in temperature can have significant impacts on public health. Global warming fundamentally alters ecosystems and environmental processes, increasing human exposure to substances known to cause cancer. The melting of glaciers and the deforestation of vast areas are just the beginning. These changes disrupt natural barriers and release previously trapped pollutants into the environment, creating a cascade of health risks. Wildfires release harmful pollutants that can travel far, affecting air quality for large populations. The smoke from these fires contains a mix of dangerous chemicals, including particulate matter and volatile organic compounds which can penetrate deep into the lungs and bloodstream. Higher temperatures can accelerate the volatilization of certain chemicals, leading to increased concentrations in the air. This is particularly concerning in industrial areas where hazardous substances are stored. The heat can cause these chemicals to evaporate more quickly, increasing the risk of exposure for nearby communities. This creates a scenario where individuals are unknowingly exposed to a higher burden of cancer-causing agents. Everyday activities such as walking in the park or commuting to work become riskier as the air quality deteriorates. Vulnerable populations, including children and the elderly, are particularly at risk. Warmer temperatures can exacerbate the formation of ground-level ozone, a harmful air pollutant linked to health problems. This ozone is not the protective layer high in the atmosphere, but a dangerous substance at ground level that can cause respiratory issues and other serious health conditions. Dr. Sung-Soo Chun noted that temperature rise likely acts through multiple pathways, increasing exposure to known carcinogens. His research highlights the complex interactions between climate change and public health, emphasizing the need for comprehensive strategies to mitigate these risks. The environment becomes more laden with hidden dangers as the global thermostat continues to rise. The cumulative effect of these changes poses a significant threat to human health, making it imperative to address climate change proactively. Climate change poses a significant threat by disrupting healthcare systems designed to detect and treat cancer. Extreme weather events can damage hospitals, force evacuations, and interrupt essential services. For cancer patients, these disruptions can lead to delayed diagnoses and interrupted treatments. Major hurricanes can make roads impassable, cause power failures, and force medical facilities to close. Patients needing regular appointments for cancer treatment might find it impossible to reach their oncologists. The cumulative effect of such disruptions can significantly undermine public health efforts. Emergency response and treatment for acute injuries often take precedence, diverting resources away from routine care. Dr. Chun highlighted that rising temperatures can disrupt healthcare delivery. Building climate-resilient healthcare systems is essential for effective cancer control. The research highlights an increase in female cancers, suggesting women may bear a disproportionate burden of climate change's health impacts. Physiologically, women experience distinct life stages that might make them more susceptible to environmental stressors. Endocrine-disrupting chemicals implicated in hormone-sensitive cancers are widespread in the environment. Climate change can exacerbate exposure to these chemicals. Socioeconomic factors and gender roles can also place women at greater risk. Marginalized women often face multiplied risks due to environmental hazards and limited access to healthcare. Recognizing these specific vulnerabilities is the first step towards developing targeted interventions. Protecting women's health in a warming world requires gender-sensitive approaches. The alarming findings linking climate change to increased female cancer rates emerge against a backdrop of contentious political discourse. When policymakers dismiss the severity of climate change, it undermines efforts to mitigate it and hampers our ability to prepare for its health impacts. The decision to reduce climate scientists at the Environmental Protection Agency serves as a stark illustration of this problem. Such actions create an environment where science is devalued and evidence-based policymaking is obstructed. This impedes the development of strategies to protect vulnerable populations. The political context is central to our ability to address the hidden cancer crisis potentially fueled by climate change. Ignoring the evidence carries a heavy cost measured in human lives and suffering. Strengthening cancer screening programs becomes an even more critical line of defense. Early detection is paramount in improving outcomes for most types of cancer. Ensuring women have consistent access to recommended screenings is essential. The findings from the Cairo study underscore the urgency of this. Public health campaigns should emphasize the importance of regular screenings and address barriers to access. Screening programs need to become more resilient to climate change disruptions. Strategies must be developed to ensure continuity of screening services. Investing in resilient infrastructure and flexible service delivery models is crucial. Strengthening cancer screening programs is a tangible step that can save lives. Robust and accessible screening programs are an essential element of climate adaptation and public health security. Building climate-resilient health systems is essential for protecting public health. This means creating healthcare infrastructure that can withstand climate-related shocks. Hospitals should be built or retrofitted to resist extreme weather. Ensuring reliable power and water supplies is crucial. Supply chains for essential medicines must be secured against disruptions. The healthcare workforce needs to be prepared and supported. Public health surveillance systems must be enhanced to monitor changes in disease patterns. Integrating climate change adaptation strategies into health policies is necessary for building resilient systems. The study linking rising temperatures to increased female cancer rates serves as a wake-up call. We urgently need more research to understand the mechanisms through which climate change influences cancer development. This research should explore the interplay of heat, environmental carcinogens, and physiological vulnerabilities. Funding for such research should be prioritized. There must be broader recognition of this emerging threat among policymakers and the public. Integrating climate considerations into national cancer control plans is essential. Educating healthcare providers about these potential links is crucial. Public awareness campaigns can empower individuals to support policies addressing climate change and health. Resolute action is required to mitigate climate change and protect public health. The time to act on the intertwined crises of climate